Maintaining a healthy weight throughout childhood and adolescence is critical for establishing a healthy lifestyle in adulthood. Many healthcare organizations promote initiatives for the future of overall health. Bright Futures, led by the American Academy of Pediatrics, supports services that encourages the positive health maintenance of children and families. Sustaining a healthy weight is dependent on many factors, including genetics, metabolism, and the environment, with two of the most important factors being diet and physical activity. Neglecting a child's health can lead to obesity, and because of it, a host of many other chronic health problems, such as diabetes, hypertension, hyperlipidemia, cardiovascular disease, self-esteem issues, and social stigmas. The CDC defines obesity as a body mass index equal to or greater than the 95th percentile for age. Current prevalence of obesity among 2 to 19-year-olds is 18.5%, or almost 1 out of every 5 kids being obese. Certain risk factors have been documented that can place children at a higher risk of becoming obese. These include poverty or low socioeconomic status, single-parent households, parents who are themselves overweight or obese, a poor parental educational level, and race and ethnicity. Protective factors for preventing childhood obesity include breastfeeding, a positive parent-child relationship, eating family dinners together, and staying physically active. To prevent childhood obesity, healthcare professionals must work with families to influence and change negative behaviors and reinforce positive efforts that support upholding a healthy weight. Ways to accomplish this include communicating effectively with families, avoiding using disparaging terms related to weight, being sensitive and mindful of specific cultural traditions related to either body image or diet, recognizing when there is a readiness to change within the family dynamic, and fostering affirmative parenting techniques. So what can parents do? Promote positive lifestyle habits during pregnancy. Avoiding alcohol, smoking, and other unhealthy practices will nurture the health of the developing fetus and will benefit overall family health. Fostering healthy weight begins at birth. The American Academy of Pediatrics recommends exclusive breastfeeding, ideally for the first 12 months, but hopefully at least for the first 6 months, in addition to parents recognizing their infants' satiety cues as to not overfeed them. As children grow up, introducing a diversity of foods with different tastes and textures will encourage the recognition and acceptance of consuming healthy foods. The CDC recommends parents balance their child's caloric intake with their degree of physical activity. Also, encourage healthy eating by limiting sugary beverages and sweets, eating reasonable-sized portions, adding in more fruits and vegetables, and switching out refined carbs for whole grains. The eating of family meals together at the dinner table without the distractions of electronic devices has been associated with higher intakes of fruits, vegetables, whole grains, and calcium products. If your child is not hungry, don't force them to eat. This leads to consuming excess and unnecessary calories, a leading cause of childhood obesity. Another recommendation is to allow your child to be a part of the food buying decisions. Make it a game. Let them pick out a different colored vegetable every month. 1 month is green and the next month is purple. Likewise, let them help in the kitchen cooking meals. Children will be more apt to eat healthier foods if they have helped to prepare it. Plan physical activity together as a family. Play soccer or tag with your children, play on a playground, or ride bikes together. Bright Futures recommends at least 60 minutes of physical activity a day, either unstructured or part of a team program. Break the time up in smaller increments for younger children who may have a limited attention span. Decreasing the amount of sedentary time is just as important as increasing the amount of active time. The American Academy of Pediatrics recommends no screen time for children under the age of 2 and limited screen time of no more than 1 to 2 hours a day for children 2 years and older, depending on age. Removing televisions and electronic devices in the bedroom has been shown to decrease the amount of inactive time as well as improving the quality of sleep, both of which can diminish the proportion of childhood obesity. What can schools do? Limit the amount of unhealthy options. Substitute water for soda and juices. Advocate for a wider range of fruit and vegetable choices and permit students enough time to consume and digest their food. Let students play outside or on the playgrounds before and after school to get in the recommended amount of daily physical activity. As healthcare professionals, we need to be aware that some families may have limited access to means and buying healthy food, therefore creating a potential food insecurity. Supply resources, such as for SNAP benefits, and local community organizations that can assist in providing healthy food alternatives for families. Helping to identify children with special health care needs that may require additional supplemental nutritional demands can assist families in helping them maintain a healthy weight for these children throughout their childhood and adolescent development. Attaining optimal physical health and stopping the epidemic of childhood obesity starts with changing the built environment. This means encouraging more parental involvement through child development, increasing physical exercise, improving dietary choices, and strengthening the family-provider relationship. There are a number of resources available for families and parents who wish to learn more information regarding how to promote and maintain healthy weight during childhood. These include the Bright Futures website, healthychildren.org, the American Academy of Pediatrics website, and choosemyplate.gov.